Vista's Insight Progress Monitoring software is designed to identify and track those issues that are directly related to treatment success. We will monitor your patients for all relevant co-occurring disorders, suicidal thoughts and self-harming behaviors, cravings, and satisfaction with treatment. Everything we do is patient-reported online. How it works is that when a new patient enters treatment, your intake coordinator will open up Vista software on an iPad or laptop. They'll click on New Patient, which will log them out of the software and open up the Next Patient Permission form. And then they hand the iPad to the patient, who enters all of their information and gives Vista permission to collect their information and immediately report it back to your center. Once we have their permission, they're taken directly to an intake questionnaire where we get all sorts of information about what brought them to treatment. If they're in substance use disorder treatment, what's their primary drug of choice, and their drug and alcohol use history and addiction severity. We also get all sorts of information about quality of life metrics, their health, etc. And this is also where we screen them for the different mental disorders. We use the same academically validated scales that your clinicians are undoubtedly already used to using, like the PHQ-9 for depression and the GAD-7 for anxiety. So the intake questionnaire ends up taking about 20 minutes for your patients to complete. But at the end of it, we know a tremendous amount about your patients. And from that point on, we only ask about the issues that we know they're wrestling with on the update surveys. So the update surveys only take 2 to 3 minutes for the patients to fill out, and they're really not burdensome. These are designed to be given on a weekly basis, but you can give them on whatever schedule you want. Your clinicians can request them at any time, and we can also automate the sending of these patient requests. And then finally, we provide all of the data to your clinicians and management in real time in detailed patient dashboards. This is what you see when you log into Vista software for the first time. You'll see a list of all of your patients, and you'll notice that some of them have 1 or 2 red flags next to their name. Those are patients that in their most recent survey reported some level of dangerous thoughts or behaviors. And 2 red flags is what we call a critical alert. It's a patient that on their most recent survey reported a high level of suicidal thought with possible intention to act. As soon as we receive one of those surveys, we will immediately send a text or email to you with a link to this patient's survey saying, here's a patient reporting very dangerous thoughts or behaviors. So let's say you want to see how a particular patient is feeling. All you have to do is click through on the patient name, and you'll be taken to their patient dashboard and see all the different things that we're monitoring this patient for. The black bar on the left is how the patient reported feeling in the 30 days prior to treatment. So what you can see is that this patient reported being very severely depressed prior to entering treatment. She's been doing a lot better since she's been in treatment, but something just caused her level of depression symptoms to spike. We're also monitoring Angela for anxiety, trauma, suicidality, self-harming behavior, several different eating behaviors, whether she's using drugs or alcohol, the strength and frequency of her cravings, how well she's getting along with her family members, Angela is apparently in outpatient treatment since we're monitoring how many days a week she attended treatment. And we always ask a satisfaction with treatment question. And at a couple of different points, Vista will ask an open-ended question. And what you'll find is that a lot of times your patients won't bother to answer, but those that do will often give you a very different type of information than they do face-to-face, because some patients are just a lot more comfortable talking to the anonymous internet than they are face-to-face. A couple of other things I'll show you on this patient dashboard. If you want to download a copy of this report to your computer, you just press Generate PDF. You can see exactly how your patient's reported feeling by digging into any of their surveys. So we're looking at Angela's most recent survey. And if you remember, her PHQ-9 had spiked. So you can actually go down and see which questions did she say she was feeling this way nearly every day. Another thing I think you'll find really useful is this patient summary report, because it reports a lot of the information that your patient told us at intake were the reasons that she came to treatment. So what you can see is her primary drug of choice, how much and how she was using, what other drugs she was using prior to treatment, how long she's been using her primary drug of choice in a problematic way, how severe is her addiction, what led her to come to treatment, and does she have some specific treatment goals that are not drug and alcohol related, like I want to regain custody of my kids, or I want to go back to school. How motivated is she to remain drug and alcohol free post-treatment? How many previous substance use disorder treatment programs has she attended? And how about in the last year? There's a number of different pieces of demographic background and information on criminal justice related offenses. And you can also see any chronic health conditions that Angela struggles with. You can see whether she has chronic pain, whether she's a smoker, and is she a heavy user of the ER. So if you look at this prior to meeting with Angela the first time, you can get a lot of information that will help you be most productive in your first session with Angela. And also will provide a lot of the information that, combined with Angela's intake, for her biopsychosocial. The last thing I want to show you on the software is what we call the survey link page. And this is how you enroll patients in the software and track what surveys they've submitted and when their next one is due. So for example, let's say that Dana is coming in to meet with you tomorrow, and it's been a while since Dana has filled in her survey. You can click Send Request, and we will email or text a customized link to Dana's next survey directly to her with a request from you that she do this update survey quickly. For programs whose patients do have access to their phones, we can automate the sending of these requests. Most of our IOP programs, for example, have a send requests on Sunday afternoons to all patients whose next survey is due, so that when their clinicians come in on Monday mornings, they have updated information for most of their patients. If Dana does not have access to the internet or a smartphone and is in residential treatment, you can have someone on your program team find her in a quiet moment, click on her name here, which will open up her next survey, and log them out of the software. And then two or 3 minutes later, her update information will be available for you to look at. One of the things I think is the coolest feature of the software is our group summary reports. So what you can see here is for each of your patients, we will plot their most recent data point as a function of how long they've been in treatment. And we'll label any patients in the yellow or red danger zone so that in a matter of moments, you can scroll down and you can see which of your patients seem to be really struggling. And you can decide that you're going to pay some extra attention to them today as a result. Vista's data analytics platform lets you look at 40 different patient-reported metrics by program, by clinician, and by time period. This is the patient progress chart. What you can see is that 70% of the patients came in reporting being moderately or severely depressed. And by the time they left treatment, this had dropped to 9%. You can see this information for all of the different types of mental disorders that you're monitoring patients for. You can see the improvement during treatment in suicidality and also in eating disorders. You can look at program completion and see that 64% of your patients are completing all recommended treatment and another 9% completing at least one level of care. Unfortunately, 15% are leaving AMA. You can see the level of patient satisfaction with treatment, and for patients about to leave treatment, were they asked about their treatment goals and were their treatment goals met? But there's a lot of other information here besides. You can look at primary drug of choice, addiction severity, and how you read this is that the dark red bar, those patients were reporting having all 11 of the DSM-5 symptoms of substance use disorder in the year prior to entering treatment. You can see what percentage of your patients say that they will do whatever it takes to meet their drug and alcohol treatment goals. There's information on the number of previous substance use disorder treatment and whether patients are taking medication. The demographics page allows you to look at your patient population by gender, age, and what brought them to treatment. You can see what percentage were living in a stable living environment prior to treatment and how many were gainfully employed or going to school. You can also see where in the country your patients are coming from. There are 8 different data analytics tabs, all of which you can analyze by program, by clinician, and by date. The patient's comments tab, you can actually even analyze by satisfaction level of the patient. So if you want to dive in and see, is there an issue in one of your programs that is starting to get patients very dissatisfied, you can hopefully identify that very quickly. So I think you can see that the data analytics platform allows you to pretty easily see what your center is doing well, and also to identify some potential areas for improvement, as well as seeing changes in your patient population over time. Vista's outcomes research follows up with patients 1 month, 6 months, and 12 months after they leave treatment. And we're looking to learn a number of different things. First of all, did they meet their drug and alcohol treatment goals? Or if they relapsed, have they been able to regain active recovery? We know what different disorders they were struggling with prior to leaving treatment. How are they doing today? And then we get a lot of information about what impact treatment has had on their quality of life. For example, were they bouncing sofa to sofa before and now they have their own apartment? Are they back working or back in school? Have they been able to avoid any more run-ins with the criminal justice system, etc.? How the research works is we will reach out to your patients by text, by email, and also by phone. We'll make 10 to 15 attempts to reach them each time. And we even pay the patients a little bit to take the surveys. If they submit a survey, we can instantly text them the link to a Starbucks or Target gift card, or we can mail it to them if they prefer. And if we're unable to reach the patient at all, we will also reach out to locator people like a mom or a spouse that the patient has given us permission to contact in case we are unable to reach them. As a result, our researchers are typically able to reach 50 to 60% of your patients at each of these different time periods. Now, one thing that's important to understand is that while your patients are in treatment, we promise that everything they tell us will be immediately reported back to you. But once they leave treatment, we promise your patients confidentiality. The reason for this is we need them to be able to report to us that they are back injecting heroin, for example, without being worried that this information would get back to their clinician, who they know would be devastated to hear this. With one exception, however, and that is if a patient reports using during a survey, at the end of that survey, we'll ask if they would like to be contacted by someone at the treatment center to discuss possibly returning to treatment. And if they say yes, then we instantly notify your admissions team. So because we're the keepers of the data, it's really important we report this back to you in very useful fashion. So you will receive a very detailed treatment outcomes report once a year that is designed to both answer the key questions of your payers and prospective patients, and also help you identify opportunities for improvement. For the first time, you'll be able to answer questions like, what is your success rate? What percentage of patients were reachable and abstinent for at least the last 30 days at 6 months and 1 year post-treatment? And how does that compare to Vista's norms? So after following up with about 10,000 patients at 1 month post-treatment, we found that about 42% of patients will report being abstinent since treatment at 1 month post-treatment. But the last 30 days abstinence rate drops to about 36% by 6 months post-treatment and stays there at 12 months post-treatment. We also report the difference between the pre-treatment year and the post-treatment year in the number of expensive medical interventions. So hopefully you can make the case that this savings alone in ER visits and hospital stays and detox treatments more than covers the cost of your treatment, and therefore you deserve higher reimbursement rates or pay for performance bonus. You can also show that not only were your patients far more emotionally healthy by the time they left treatment, but they stayed that way through the post-treatment year. Families will be very interested in seeing the improvement in the percentage of patients who are gainfully employed or going to school between intake and 6 months and 1 year post-treatment. And finally, we also report to you the difference among your own patient population in the abstinence rate between patients who successfully complete treatment and those that leave early.